Good afternoon, everyone, and welcome everyone who's managed to join this webinar, this very special webinar on AI in finding answers to clinical questions. Now, the reason I'm the convener, Dr. Ruma Satvik from Sir Gangaram Hospital, and along with Dr. Siddhartha Nagareddy, who is the Secretary IFS chapter from Andhra Pradesh, we have organized this short webinar for you all on AI in clinical on finding answers to clinical questions using AI. Now, there is this constant tussle between, there's a clear divide, age divide between individuals who accept it and individuals who want to very readily use it, but without knowing the proper use of it. And it's all around us, no matter what people like me, who sort of probably are on the other side of the divide, feel about artificial intelligence. This is here to stay. So might as well learn the right use of AI in finding answers to clinical questions. We perhaps use it for several reasons. We use it for academic writing. We use it for literature search. We use it for, responding to most of our queries. But this specific topic is on one little aspect of what we use it for. And this is finding answers to clinical questions, which is something sort of we ask Google and Google responds and how we kind of respond to it. So I belong to a generation that does traditional literature search, which is on PubMed. But let us see what our very, established speaker, Dr. Pankaj Shah, who is the Associate Dean of Research at Sri Rama Ramaya Medical College from Chennai, has to say about this. Dr. Pankaj Shah wears two hats. He's the professor of community medicine at SRMC, but he also holds the additional responsibility of being an associate dean at SRMC. Uh, uh, Dr. Pankaj, the stage is yours, and hope you can start this for us. Your microphone is off.
Good evening, everybody. Thank you, Ruma Madam. Thank you, Dr. Siddharth, and all of you for this opportunity. I'll just share my slides. Just for better connectivity, I'll switch off my video. Just confirm if I'm audible and slides are visible.
Yes, sir, you can go.
Okay, yeah, thank you. I just tweaked the question. Instead of AI finding the clinical questions, I have made it as AI trustworthiness in the healthcare. And I am allotted probably approximately 15 minutes or so. So I will try to do justice best what can I do with the topic. Now, before I start the disclaimer, as we are all new to AI, many of the things we have to really validate and test before we use. And I'm really thankful to my teachers who have given me whatever guidances because of which I am able to speak in front of you. Also, this small session of 20 minutes or 1 hour webinar will not be able to make us expert unless we really look at it. AI has changed our life in all throughout. And if you look at it, there is no area in our day-to-day activity at a professional level or at the personal level where AI has not changed. Starting from AI home facilities available. When we get up in the morning, AIs are available on our smartphone, pad, and everywhere. The AI is everywhere. So there is no way we can run away from AI. The only thing is we have to understand and adapt it. Also, one of the tricky things which when AI was launched, ChatGPT, which was the first contact for a common population to come with the AI, they thought that is going to replace the human being. I think similar feeling came when computers were launched and they thought probably computers will take away humans' work. But today's era, we know that computers have helped us to improve our efficiency, and the same thing we could do in a shorter period of time. I think the same way the AI will work, and all those people who know AI will replace all those people who do not AI. With that short disclaimer, I will go ahead. One more disclaimer I want to give. I'm having a background of community medicine, and I largely take an interest on ethical and responsible use of AI in healthcare and its validation. I do not have any experience of AI use per se in reproductive system, because there is no prime area. So largely I will concentrate here on the various ways before we implement in practice what as a clinician we can look at the AI. Now there is one good article if you want to see in BMJ with respect to artificial intelligence tool development, what clinicians should know. We understand all are busy in clinical practice, and many times the artificial intelligence and the language used in this paper with different algorithms many times goes out of our understanding. So this is one of the simple probably paper which can talk on how artificial intelligence tool development can help. There are two stages in any AI used in our day-to-day life, including healthcare. One is a development and second is use. As all you know, when the chat GPT was launched, the chat GPT was trained with so much of information, volumes and volumes of information for months together, years together, and then got after training, algorithm was developed on basis when the question is asked, the AI is going to give the answer. Also, you must have heard during Chat GPT, other parallel AI things came up, and some were giving correct answer, some were giving wrong answer. That means there is a chance of hallucination. I will always compare AI with any of our student, where a guide or a teacher is teaching, the AI is taught with the literature or whatever sources are available with us, and AI is like a student. How AI can make a mistake in the exam or otherwise, sorry, the student can make a mistake, same way the AI can also mistakes. Hence, before we start implementing in any practice, we certify the students. Same way, some kind of a validation has to happen with AI tools, AI devices, and now there is an era where there is a lot of wearable devices are going to be taking place. As all of us are aware, there are watches available which claim that if the heartbeat stops, the ECG will record, and then it will emergency call the doctor or the immediate care provider or the spouse or something like that. But who has done the validation of apps? Unfortunately, many of these mobile apps, when they are available on Google Play Store or Apple Store or maybe Windows Store, people just download it. But at the background, none of us know it is a validated app or no. And hence, before any AI development, any device development, the validation of that app or the device has to happen. Now, as I told you, I do not have any knowledge with the reproductive medicine per se, but according to my understanding and the article which I have quoted, which is recently published in 2025 with respect to AI integration across ART services which are possible. It can be used for diagnostic, where you can have predictive models with respect to infertility treatment, risk assessment, risk stratification, also triaging the patient depending on which group of patients will get a benefit over other people in a kind of thing. It can also use for the simulation purpose. As you are well aware compared to me, that ART treatment involves a lot of hormonal changes and hormonal stimulating drugs and so many things happens during the cycles which may increase the chances of fertility. Those kind of optimization, the outcome prediction, the ovarian response models can be predicted and can be made with the simulation. Actual fertilization, which sperm or oocyte is going to be performing better today, probably with the human eye microscope the things are being judged. But AI can also help in all those aspects because it can have a knowledge and the skill of identifying the best sperm or ova which can get fertilized and grow into further development probably in a better way. Then even for embryo selection, and finally the most important, which can be done anywhere in healthcare including ART, is the counseling and the patient communication. Many of this can act as a chatbot. Some can be have to be used at the instrumental level. Hence, if you look at the overall scope, it can be a chatbot, it can be a robotic structure kind of thing which can do communication, or it can be a microscopic structure, a microscope which can identify the sperms or ova, or it can be at the diagnostic tech level, it can be at simulation level, or it can be a device level. In addition, there can be a new drug development also possible in ARTI, where the new hormonal stimulants can be used, which can have a better life period. The cost involved, which involves with the pharma development, can also help. And a lot of good pharma development has happened with the AI coming into picture, where the whole duration of the drug development is relatively reduced. This is another article which talks about how AI can be used almost all the level. If you see this picture, is classically described procedure scheduling to workflow optimization, ovarian stimulation, gamete selection accuracy, improve of the embryo selection, and the most important in ART, which is also required in other also, is the quality control mechanism and the key performance indicator, how things will happen, are very, very important. So all the places, if you look, AI can help us, and AI can inform and better perform. This is the same article which has given a summary in a form of a systematic review, where at different places people have tried developing different AI tools which can be used for different kind of processes with reproductive medicine. And if you go to this articles, we can find out different references and go into detail. Many of these may not be approved by FDA. Many of probably not approved in India by ICMR. And hence, once these tools or the techniques or the procedures or the device are developed, have to be tested and validated ethically and responsibly way, even for Indian population, before it becomes a part of the practice. So there are AI applications for gamete selection, sperm classification, motility analysis, morphology assessment, oocyte quality assessment, real-time adjustment, data integration with the previous cycle, and other performance. Same way for embryo selection, there are still more methods which can be used, and the list is numerous, with the genetic data integration, predictive modeling, real-time adjustment, scoring system, outcome analysis, etc. But as I informed, this needs to be validated in an Indian population before it goes on. As you were talking about, quality control is very, very important. And key performance indicators are important even for those issues many of the AI tools have developed. So we need to understand AI is phenomenally increasing in all the specialties, and all these AI tools are going to use inbuilt algorithm, which is used for training of this artificial intelligence machine, something similar to a student who reads the textbook and gets the information. Now, there are a lot of issues in general with AI also will creep in these kind of products development. For example, many of these AI tools are trained on Western literature. Indian literature may not be available. Also, there are a lot of biases involved in the training, where there can be a gender bias, there can be a racial bias, and all those issues which in general percolate and create problem in AI system will also come into this. Another common problem with AI is the hallucination, giving a wrong answer, or hypothetically creating scenes and cases and treatment, those things actually which are not existing when you cross check with the cross references. So though over last 2 years, as the AI has been developed, this hallucination chances are decreased, but still it needs a proper confirmation before we go into healthcare, because healthcare is slightly different compared to other industry when we go on. And hence the most important in healthcare, which will apply to reproductive medicine and surgery also, is trustworthiness of this AI in healthcare. In addition to the pure scientific validation, it has to be robust, it has to be reliable, it has to be reproducible and accountable. It has to be transparent and accessible. That means if I'm using a say AI microscope for sperm selection or embryo selection, as a reproductive medicine expert, I should be very well aware how it is validated. who has tested the quality, and how we are sure that the AI is really assisting the clinician or the doctor for these kind of things. Privacy and security is very, very important, because as you know, when you ask a question to chat gpt, the chat gpt also learns from your question. And when the same question is asked after some time, the answer changes, because the chat gpt has learned from the questions and the content what you have asked earlier. And hence, when these AI based systems are going to be used in healthcare and reproductive medicine, privacy and security plays an important role. It has to be unbiased, as we have said. Many of these AI trained technologies are westernized in nature, and the racial and other kind of biases may exist, and we have to look at this. It is very, very important to look at AI in healthcare, because the market is going to be expanded every second. A new healthcare AI system in the healthcare is coming up. As far as the India is concerned, this is another article which talks about AI-driven healthcare innovation, and some of them are with respect to so-called pregnancy and other things. But many of them tried are currently on the infectious diseases, where probably developing a tool is very, very easy. They are tying AI tools with respect to wearable devices. So there is now one study in 2023, if you see, to combine the concept of blockchain and machine learning algorithm for the data collection and storage, analyzing maternal data securely and reliably, also to predict the risk levels of pregnancy complication. So as you see, even Indian AI is developing, which is Indianized to the Indian population. As India is a vast country, we also need to look at those validation with respect to different parts of India, like any multi-center study, and we can do it. So this is an article which is published in the Future Healthcare Journal, which talks about how AI system needs to be validated before it gets implemented. The first stage is a design and development. That means identify the right problem for which we need AI. Stakeholders engagement has to be there, where the clinician and the IT expert both should be there. Understand the context and the use needs, what is the clinical workflow. Ethical implications will be always there, so that privacy, security, and all other ethical aspects are taken care. And finally, the validation and evaluation starts. The validation needs to be our clinical validation, statistical validation. Also, we need to look at the simulation and the clinical utility. And finally, the cost economics is very, very important when these models are going to be implemented in the real practice. Many times we see in our literature where we have seen when the chat GPT came, it was told to write a JEE exam, told to write a NEET exam, and so kind of exams they have written. And we have said that AI writes the exams much better than a student or something like that. Now we need to understand the concept of validation first, and which as a clinician we all should know. When I'm comparing a new entity with something is a gold standard, conceptually the new entity cannot be better than a gold standard. We believe that a student can never be a better than a teacher in a particular exam session. In a clinical experience, it is different. After the student gets trained and a lot of other experience, because the teacher is a gold standard, the student can perform as good as teacher but cannot become a better than. Same concept of validation applies here. Any device, any new screening method, any new screening test cannot be better than gold standard. Pap smear can be as good as gold biopsy, but it cannot be better than biopsy. That's a classical process of validation, where we calculate the sensitivity, specificity of a new test or the new technique over the gold standard. But when these things are being tested and they claim that my AI model or AI microscope or AI mechanics is going to be performing better than my clinicians, then there is some query, and the process of validation is not done properly. If you want to really find out if my AI device or my AI tool or AI microscope, how it can be better than clinician, then we need to use a third method. For example, a study is done where the AI microscope assists the doctor and look at the fertility rates, the chances of pregnancy. And in other case, only the doctor does it, and try to compare these two different models. Here, what we have done is we have additionally added the AI system, and we have looked at the third indicator, which is the pregnancy level. As we said, when there are only two things, a new method and an old method or a gold standard method, the new method cannot be the better than gold standard. So when people say my AI microscope will better detect the embryo compared to clinician, I really get doubt on those kind of validation process. So we need to be clearly understand where the validation happen. It is happen in the Indian population only. Then once the validation is done, multiple centers try to do validate and it is accepted level, it has to go into the regulatory approvals, and only after regulatory approvals we can use it. Wherever devices are there, we have a international regulatory system as well as the Indian regulatory system with ICMR and drug controller, central licensing authorities, and so many government approval comes into picture, and then we have to look at, and finally we have to start implementing. But once the start implementing, like any drug, there has to be a post-marketing surveillance. How the device is there, what is the chances of safety, what is the prospective performance, really how much is going to help. So as we said, in this validation is very, very important. Lot of tools are coming from start to end, all the procedures which is involved in ART, and international guidelines are there. In 2023, even ICMR came out with the AI guidelines, and it is a very comprehensive guideline which is prepared by ICMR with respect to last few pages, talks about the essential issues which needs to be taken care. This is one of the article which is published in Hindu in December 2024, saying that ICMR develop an AI tool to predict IVF outcomes in a men with infertility. This is just one example. As we know, infertility is an important issue, and male infertility is one of the important issue. It can predict IVF outcomes, but these kind of AI tools have to be tested, validated, and it can be used. So if you see in the whole AI system which is going to change our day-to-day life, first we have to design and develop the system, validate it perfectly, validate in Indian population, get the regulatory approval, follow the whole process ethically and responsibly with the informed consent, which is the important ethical guideline, along with the all other things with respect to privacy, security, and reproducible data, accountability and transparency with respect to the clinician when they use this kind of tools, where it is developed, how it is developed, which are the population, avoiding all kind of racial biases, the his hallucination and the wrong answers, all those issues have to be tested, and then only it can be used in the clinical practice. AI can go beyond this device development. It can help for answering our clinical questions in the literature, and the same principles apply where earlier we were using the Google search. Now many times we use the chat GPT, and there is a big danger when earlier patients used to come after reading a Google search, this is probably the diagnosis or this is a treatment. Same thing will happen as the days come later, where they will say, you are telling this is my treatment, but the chat GPT has told this thing. Again, those issues have to be validated. If you realize many of these AI tool, when we ask the question, the prompt is very important. What kind of question we ask and how we develop the chat GPT to understand. If we say the chat GPT has an experience of OBGY for 15 years and etc. etc. That means it takes that literature algorithm from those areas and try to give the answer. So those kind of clinical questions which patients are going to ask is going to be challenging for future to come. But as far as the clinicians are concerned, when they ask these questions, they can prime and understand the method of prompt engineering so that the right prompt is given. And when the right prompt is given, naturally the answer will be in better quality. But again, cross-referencing and checking of those answers have to be done before it is implemented in the patient healthcare and probably in devices. The government, FDA, ICMR, drug controller, etc. approval will come. I will just stop it here with the again disclaimer. I have no experience on the reproductive medicine devices per se, but validation and ethical responsible use is very, very important. All of you are the expert in reproductive medicine. Once you validate these things in Indian population, it will be very easy to use them with all those things. Thank you very much, and thank you for patient hearing.
Thank you, Dr. Pankaj. That was a great introduction to AI use in healthcare. And I mean, I'm sure we all are learning, even at the stages that we are at. And as we sort of go ahead with so you must be a professor, and you also perhaps guide students, you check their thesis, and the people who are with us today, I'm sure some of them are students, and they'll have questions. And one of them that I'm going to pose maybe on their behalf, but I ask and request the others to also put their questions. These are the ones that I have. Are first of all, what is your biggest criticism of AI usage in, we are talking about academic writing. Let's keep reproductive medicine apart. Let's keep finding answers to clinical questions apart. And maybe we can share our own experiences of how we look at clinical answers. But since you kind of helmed the research program, I'd like to know from you, what is your biggest criticism of using AI tools in academic writing?
My biggest criticism will be in a single line when ChatGPT is to write the whole paper or the whole protocol without a student or a faculty or a clinician applying their brain. They
Right,
cannot say, I told the ChatGPT to write introduction, write methodology, write the analyze the result, and I just reviewed it and found it appropriate.
right,
The chat gpt is a great learning tool for everything and anything when it even comes to academic writing. As
right,
PowerPoint helps us, chat gpt or any AI tool will be helpful, but we need to be very careful because a lot of material which is generated from AI as a statement can be a copyright violation. Many of the references are not existing in the literature, though the references are given. So when we give academic writing, we have to first make sure we prime the chat gpt or AI tool to behave that kind of a experienced person and
yeah,
guide us in the academic writing. But
yeah,
don't say, please write 250 words introduction and take it, read it once, and then that's my biggest criticism. We have to
right,
use our own mindset and use the AI in a better way. Just to add further, now for all academic writings, now probably it has not come in the dissertation and thesis according to my knowledge,
yes,
but all papers which needs to be published,
hmm,
they say author guideline that AI cannot be an author. Number one, the
right,
author has to read the content which are generated from AI and then have to take a responsibility and accountable to the content. Third, they have to do complete disclosure. What kind of AI use, which model, which date, etc., etc., etc. And to go further, there is a journal known as Frontiers in Psychology. I have seen only in that, where they have said you use AI, disclose it, and please give us the complete prompt list with the answer what you have asked, so that it
right,
becomes a complete disclosure. And I have not said just write the full paper and submit to a journal. So
right,
disclosure is the most important savior in AI. But please do not leave our brain when we write academic writing. It should help us, assist
right.
us, and not become our owner. That's my biggest issue with the AI.
Correct. So that's true, because I look at protocols that our DNB students write and submit to NBE. And of late, just the numbers of protocols that come in, with these flowery languages, which sound so philosophical, maybe making overstatements, is of course a problem. And you can instantly recognize that this language cannot be the students. But more importantly, that may not be a problem at all. The problem here is perhaps the fact that uh, just yesterday, for instance, I was looking at this protocol, and the citations were 30, right? And all of them were very beautifully listed in Vancouver style at the end. The references were there, except that about half of these were fabricated. When you put them in PubMed, and you find that these articles don't exist, the author exists, perhaps the journal exists, but ChatGPT, remember, has been trained to sort of do what is known as token search. So there are phrases, 4-word phrases. It is able to uh, sort of automatically connect what is the most common statistical possibility after these 4 words come. It's not doing a copy paste job, but it is doing what is known as the most high statistical probability for the next phrase, it's attaching that. So when you say, give me 30 citations, it will do that, right? It will give you 30 citations on the subject. But please remember the veracity of those citations and the fact
Has to
that
be
they
checked.
perhaps don't exist. And so you have to call that out. So even if this is Chat GPT 5, it is important that, so not only that, none of these figured, so there were 30 citations, there were some 15 in the text, there were 15 that were not there in the text at all. So that is one issue. But one last question before I ask my co-chair people, Dr. Divya and Dr. Radhika, to also maybe check in with you on one or two questions that they might have. I have one last one for you. Is there anything that you can rely on ChatGPT sort of fully reliably? Do you think that there is one aspect of academic writing that it can do better than sort of maybe generating citations, which we see that it's completely fabricating it?
Probably something which I have experienced in my clinical practice or something. And if the same answer is given by Chat GPT, probably I rely because it matches with my experience.
Right.
But if that same experience may not be felt by other clinician and they may have a different experience. That's the difference. Many times people claim that Chat GPT and all AI will give a best answer for statistics,
Okay.
mathematics, because
Mm-hmm.
2 plus 2 is 4, which
Yeah.
cannot be go wrong. But
Yeah.
in my experience, when we leave this 2 plus 2, 4 and go to higher level of understanding of
Yeah.
mathematics or statistics principle and
Yeah.
analysis, even Chat GPT in my personal experience I have found to be done errors. And
Mm.
when I have indicated those errors to Chat GPT, it says, I apologize for this error and this has to be correct, something like that. So at present, I do not think so. It is 100% reliable. But if it matches with the person's or the clinician experience, probably you can rely. But the best thing to rely is always to check the cross references to make sure things are correct before implementing. And with
So,
so much of vast information, it's very difficult to check the literature thoroughly. In
right.
to make our life easy and shorter way, probably Chat GPT can highlight important landmark recent studies, etc. But
Yeah.
the Chat GPT has to upgrade till that level.
Yeah.
A study which is probably disclosed 2 or 3 days back may
Yeah.
not be acquired by Chat GPT will drastically change even my practice from applying to not applying. So those kind of experience will play. So I do not think so anywhere is 100%, but probably as per our experience, we can rely wherever matches, and cross validation is the only solution, whatever it may be. It can make our life easy, but we cannot totally rely on that. Though
Right.
soon we have AI generated trains, cars, and all those things, but they will also depend on the probabilities. What is the likely chance of making a risk or accidents? So, there'll be a driverless trains, driverless cars, and all those are all AI generated or
Yeah.
AI made
Yeah.
the things. But
Yeah.
still, probably we have to look at it till how long we are confident to sit in a car where is a no driver and we are alone. I don't know. Not at this stage. Probably after a lot thorough validation only it can happen.
Yes. So we have with us Dr. Divya Pandey. She's a professor of pediatrics and gynecology at Safdarjung Hospital. Dr. Divya, I was wondering if you have a question for uh, Professor Pankaj Shah.
Good evening, sir. That was a wonderful discussion. I was going through. I just want to know: are there any ethical, any guidelines by our Indian organizations like ICMR or DBT, which can actually guide the researchers to use this AI in their clinical research to an extent? Do we have
Yeah,
any
madam,
guidelines existing?
for conducting research, as I was showing you, ICMR in 2023 came out with the guideline for use of artificial intelligence in medical research. So this is a complete guideline from design to development, how to be used, and there is also a checklist given so that we doesn't miss any of the important aspect, and we submit those things to ethics committee depending on what kind of thing is there. If it's a device, even it has to go to other agencies approval in the government. If it's a pure observational kind of study where the government approval may not be required, with ethics committee approval and informed consent probably from a couple rather than only a wife or something, because both are involved in the infertility treatment, can be used. So there is a ICMR AI guideline with respect to research when we are doing using artificial intelligence in 2023. That booklet has come. But also we need to understand, when AI is so fast developing, many of those issues have to be evolved and changed as we move on. As far as the academic writing is concerned, other than the disclosures given by the journal, there are no specific guidelines came from any of the uh, bodies per se, though the government of India, UGC, has come out on use of artificial intelligence ethically. But the science is evolving very fast, and we need to be very careful, and open disclosure is very, very important. And as I told you, one of the journal Frontiers in Psychology, where I saw the author guideline, it says please attach the complete prompt list from start to end, so that we know how actually use the AI, and not just writing a 2 line saying that AI assisted in writing. So for conducting the research, ICMR guidelines are there. If the device is going to be CITESCO and drug controller and central licensing authority approval will be required. If AI use is going to be collaborated with an international partner, even health ministry screening committee approval, those things will be required, madam. Thank you.
So I agree. Human filter is definitely required with the AI efficiency.
Thank you, madam.
Thank you. Thank you so much. I was wondering if Dr. Radhika Potlure, our other chairperson, is here, but I can't see her name, so I guess we close this session. Thank you, Professor Pankaj Shah, for
Thanks a lot. Thank you.
talk. Yeah, and we
Yeah.
hope to have you in maybe some of our future webinars, but we'll probably focus it only on academic writing the next time we do this.
Okay, because
Will be
because
questions
here I
about
was not sure it was a pure on academic writing. If it
it
was
was
very
on
clear.
clinical question finding. Maybe I think there can be a video demonstration. Dr. Garima is going to do this next, and she's going to talk about AI tools in finding answers to clinical questions. There's a demonstration on that. But let's have our chairpersons for the second session. We have Dr. Siddhartha Nagireddy from Andhra Pradesh, Dr. Sakshi Nair from Gangaram Hospital, Delhi, and Dr. Venkata Sujata Velanki from Andhra Pradesh, from Hyderabad. Please introduce the speaker and take on with the next, go ahead with the next session.
Yeah, good afternoon, everyone. I'm Dr. Sakshi. Thank you for inviting me. So, for the next talk, AI tools in clinic for research, I would like to invite Dr. Garima Kapoor. She's a distinguished professor at Safdarjung Hospital. Dr. Garima?
Yeah. Hi, thank you,
Hi.
Dr. Sakshi. Yeah. Hello. Hello, all. And I thank the chairpersons for introducing me. So I would like to thank the previous speaker, Dr. Pankaj Shah. He has beautifully, critically told you the role of AI in the current times. And I would say this is not a talk, this is rather a demonstration. I have a very interesting task of showing you what AI tools do we have for finding answers to clinical questions. So having given this topic, I was really in a confused state because the market is flooded with so many AI tools and everyone claiming to be this, that, and all. So it really muddled me. Then after organizing it, I came out to this, that if you are talking about AI for clinical questions, who are we? Are we a healthcare professional? Are we a researcher, or are we a patient? So talking about the audience that I have here, most of us are both healthcare professionals and researchers. So what do we have? We have apps like Consensus and PubMed AI, which help us to go through the literature, critically evaluate it, and use it to solve our clinical queries. And then you have this clinical, as a clinician, we have this clinical decision support and task automation, where you can incorporate the patient's data along with guidelines, and they have the whole software, which I will demonstrate to you, which will help us know how to go about managing our patients. Again, I'm not overruling the rule of a physician, as has been previously pointed out, that AI is still in the nascent phase, and we need to take it with a pinch of salt and see how it is applicable. And if you have a researchers, we have apps like Clinical AI, which help us to go through various research questions. And if you have a patient, you can go through ADA Health, Microsoft Azure Health. These are apps that will probably give you a provisional diagnosis. They will also tell you treatment. Again, I'm not advocating it. These are controversial roles, but yes, they are there in the market. So I need to address to them. Now, talking about the clinical decision support system, basically, they are supporting the clinicians in diagnosis, treatment planning, and patient management. we are integrating AI with patient data and what we know from the knowledge. So you're combining the data and medical knowledge, and they're giving us a solution. Okay. So there are various apps that are available. One is Meredith. This is predictive analysis and using natural language processing, which analyzes unstructured medical data for with patient histories, assistance to provide professionals and decision making. So since this is a paid software and you require patient data, so I'm using the help of this YouTube video to show how it actually works. So here we're going to talk about this. Let's go through this.
So while we are at it, Dr. Garima, could you tell us something about natural?
Is the audio audible or it's not? I'm
Yes,
sorry.
I can hear you, but I can't see your slides move.
Yeah.
Cannot see the video. Just a second. Sorry. Is the video visible?
No, we can only see your slides.
Oh, I'm sorry. Okay, the video was playing. I'm extremely sorry. I thought I'll just see how to share the screen for this then. Wait a second. I will probably share the apps, and I think I can just go to the apps and I'll stop share and share again. One second. I'll stop share and I'll share my screen again. I'll go to the Google and just share the apps, right? We'll first go through these apps. Yeah. Is it visible now?
It's starting to get visible. Yeah.
And audio?
Now it is visible. Yeah, now it is there.
Yeah. Yeah. So I don't know if the audio is audible. I'll just specify. There's a software from which you can select your patient, and you from the demographic data of the patient, you can select the what are the relevant things you need to know about your patient to help you summarize, and then you can plan your treatment according to whether you want to go for a clinical trial or you want to go for a standard treatment option that is there, which is according to the guideline. And please let me know if the audio is audible or not. Then I'll explain accordingly.
So there is no audio.
Okay. So here what you're doing is they're taking a clinical trial option, whether you want to enroll or you're going for a standard surgery. And the green and red color gives you the degree of basically the significance of that. How reliable is it? If it's green, it's very reliable. If it's orange or red, it is less reliable treatment. So you know the standard treatment would be green and orange or red would be something you would do only in few cases. So you can decide according to your treatment what dose you are going to give. If the surgery is required, what is the endocrine follow-up you would like to do and what is the RT follow-up. So this is how you can plan your treatment using these AI-based apps. And these are basically your publications. Basically, if you want to go for, this is your chemotherapy, if you want to go for the dose, the drug, the publication, what are the clinical data. So you can access all this through the AI apps. I hope this was okay. And you can share this treatment file with your patient as well. So this advantage also you have that you're going to share this with your treatment with your patient, right? So with this, I'll first cover the demos and then we'll have a chat discussion. There is another demo. This is a Google Enhanced Vertex AI app that is there. So this is used on multi-language. Basically, it's on deep thinking and multi-language model. So using Gemini. So here again, you are going to have the patient ID. And again, it's in a similar lines that you're going to retrieve the patient details and you're going to plan the treatment accordingly. So here what they have done is that they have looked at what are the problems the patient has. If they're looking for diabetes, so they're getting all the relevant investigation related to the diabetes of the patient. What was her HbA1c, when was it done, and all those lists will come in this on under the patient ID. They're searching for the patient. So yeah, if you want to know about a patient's report, the fundus examination or something, you can ask for a query and you will get that relevant report for that patient. Has the patient gone done this or whatever? So you're getting the answers. Yeah. So as you can see, you get the option of what treatment your patient is on, what reference you want, how is the progress of the patient. You can also follow up with that. So basically, it can be for the clinician or you can integrate it with the patient. So this is how this app works. It's on a similar line. So yeah. So I will close this now. We go to other pages. So now coming back to our presentation, is my presentation visible? Sakshi?
Not as of now.
Now
We
is it
the YouTube screen.
okay? So I think I'll have to stick on one. So basically, what this is regarding the clinical decision support system that I was talking about, and uh, here you are basically integrating the AI along with the evidence, and basically you are using it to integrate the patient data. And these are softwares that obviously you have to purchase and you have to tailor and custom it according to your requirement. Now, coming on to the next, role of AI. When we talk about the next role of AI, so here after this, we need to understand basically when we're talking about this, there is three components. One is artificial intelligence, the other is machine learning, and the other is deep learning. So artificial intelligence is a program basically that can sense, reason, act, and adapt. That is something that's a broader perspective of when we use of artificial intelligence. When we talk about machine learning model, that as my previous speaker has already talked about, these are algorithms on which these AIs are based. Basically, on the basis of results and whatever the studies and the evidence they have, they form baseline algorithms, and depending on your response and how you're learning, the AI improves over time. Deep learning is a subset of machine learning in which multi-layered neural networks learn from vast amount of data. So here your amount of data and the interaction that happens, that increases many. So we talked about Google Vertex AI search for healthcare. Basically, it is going to analyze tables, charts, text, and give clinicians a broader view of patient health. So you have access to everything, even for data. And then you have other apps like Viz AI, which is again a cloud-based platform that use FDA-cleared AI algorithms to analyze medical imaging data, detect disease, and enable care coordination among medical teams for faster treatment decision. But again, these are just guidelines and they should not be followed by thumbs rule. And obviously, you would have to take it. Then coming on to next, the medical literature and research too, which we as clinicians come across in day-to-day practice. So we have various apps out there. So there are some of the interesting and good apps that I wanted to share with. One is Clinical Key AI. This is by Elsevier. Basically, it is natural language querying. It summarizes response from evidence-based sources and ability to to consider patient context and provides personal answers with link citation. So here I am going to now just let me know if it's visible or not when I'm coming to the clinical key. Is my screen visible? Clinical key, can you see?
I can just see the artificial intelligence resume view slides. That's it.
Acha, okay, so I'll have to share it again. So I'm going to share my screen again. I think. Here. So you have a clinical key Elsevier. It's a simple step that you can log in. You can use it through an email. Here you can see I have my icon right here. So I can type search something. So let's say we are all reproductive medicine specialists. I want to see, okay, let me ask, what is the role of endometriotic cystectomy before IVF cycle? Okay. So I want to ask this question to AI. Let's see what does it come. So a lot depends on what prompt you give. That is very important, as has also been highlighted by my previous speaker, that what results I get. So I just got one result, that is endometriosis. So maybe I'm going too much in detail. Let me go and use a broader words, use clinical keys, and I should be using less, like endometriotic cystectomy before IVF recommendations. Let's see what do I get on this. So what keywords you put, what prompt you give to the AI depends. Okay, so I'm not getting very good. Is this? So let me just put it endometriosis and let's see what do I get. I'm going to search all the AI, all the Elsevier articles, and it's going to give you the results. If you can see, I have 1076 results on this, just on endometriosis. So look at what are the filters I have out here. So here I'm looking at all books, journals, clinical overviews, clinical trials, guidelines, patient education, multimedia. So let's say journals, I would like to go for journals and I would like to narrow down my search. So with journals, let's take a minute. Okay, so it's in a subscribed content. I'll go to all types. Let me go. Just give me a minute. Yeah. So here it is. So clinical trials, guidelines, and clinical overviews have. Now, what do I want to basically narrow it down to? I don't want very old studies. So let's say I want just last 2 year studies. So I'll narrow down my search to last 2 year study, as you do in Google. And here I have this. Now, basically, they have sorted out by relevance here. They're talking about linacolics for treatment of endometriosis, relagolics, uterine adenomyosis. And here I'm having a brief summary of what this article is going to talk about. It's giving me a clinical overview. So this is how it helps you. And then you can see how I can use the filter. So this is the filter. And this is what I'm going to get out of this. So now I'm going to use the two piece. This is it. So this is the clinical overview that it is going to give me for these guidelines and all. Somewhat like what you have for this. Now let me try and use another tool to find out the same answer. So here, just 1 second. Yeah. I will use another deep search. We have consensus. So there are different apps. I'll put the same very different apps and see how I get my response. See.
So there is no audio.
Yeah, so they're just talking about deep search. We're using extensive literature search. Whatever. So you're putting a search question on the consensus app, we'll go to that app. And when you put on the deep option, you get into the deep literature search. I'll show you the difference of what you get. So you get different articles are there. Basically, it's going more in depth into the research rather than just doing with the flow. First, it identifies the papers, then it screens them, shortlists the eligible papers, get the most relevant top papers, and then it gives you the summary. This part the AI is doing for you. It is helping you search the most relevant papers, and it's going to give you a summary. I'll just show you how it works. I'll also demonstrate. Yeah. So they're also giving you consensus meter, that what is the consensus of this? Is it a good one or a no consensus? Evidence strength. Basically, they're talking about evidence strength. And there's a matrix of research gap also in this. So basically, you get more search papers on this. I will now. So now I'll just close this. Now I'm going to see. So here I'm going to tag. So this is the option whether I want to go for a pro or deep, how many I can do. So let me see. I want to see what is the role of, start with endometriotic. Let me ask the question. Endometriotic cystectomy before IVF. Endometriotic cystectomy before caps of IVF recommendations. And let's see what do we get on this. So I'm doing a pro search. Let me see first what I get in pro search. They have screened through 20 sources, and so now they have screened through all the sources, and so now what they have come with is cystectomy for endometriotic cysts before IVF may be considered in select cases like large cyst, pain or technical barriers. Routine surgery is not routinely recommended as it can reduce ovarian reserve and does not consistently improve IVF outcomes. So this is what it is going to give us. These are the indication of surgical threshold, impact on ovarian reserve, and this is how it is giving. This is giving me an update of the key papers for specific questions. These are the papers. What is the focus? What is the key insight? This is how it is going to give them. Okay. Now let me go it into a deep search. So this is the result, what I'm getting. And now let me go into the deep search. So I'll go back again. A second. Now I'm going to put the same question on deep search. I'll put role of robotic tech before IVF recommendations. So here I'm going to just do this. Because you have to be very specific few keywords. If I make it very elaborate, Google is not going to, sorry, the AI will not be able to search for this. So basically, here now I've done a deep search. So here you have uh, basically they are looking at various articles they have looked through. Productive outcome after laparoscopic surgery, and here they are given initial surveillance strategy. Now they have 50 new eligible papers. Previously they had 20. Now the number of papers identified eligible have been increased. So you have more literature search that you can do. And now they are going to do the guideline and consensus review over here. Compare surgical approaches, comparison of cystectomy, ablation, various for endometriosis, AMH, IFC success, and what is its effect on the AMH. So they have done a detailed assessment of this, and this is the list of all the articles you have. So this is how initial survey guideline consensus review they have done. If I want, I can just screen it to past 2 years, and I can go ahead with this search. So assess ovarian reserve impact. So if I go on guideline and consensus review, recommendation. So here it is giving me the guideline and consensus review recommendation for surgery versus conservative management of endometrioma before IVF. So what is it? An update on the diagnosis. So you have different articles and you can actually segment it. So it's also dividing it over here. So this is the difference between deep learning, deep searching, and this normal AI. This is how we do it. So the management of before IVF recommendation on deep, they have 50 sources. Current evidence does not support routine endometriotic cystectomy before IVF in asymptomatic women, as surgery may reduce ovarian reserve without improving IVF outcomes. Individualized management based on symptoms with signs of ovarian reserve is recommended. So this is how it has summarized the whole result. You can all go back and try it on these apps and see. Obviously, you have to take the references and citations with a, you have to cross check them because they may not always be reliable. So for that, I definitely cannot vouch. But this is how it can work, right? So coming on to another app that is there, I'll also share this one more app that is Elicit. Again, here it is. This one is based on researching the systematic review. So let's see. Let me see what is it have role of or just endometriotic cystectomy. I'm just putting the same. I can put some other question also, just to let you know how it before IVF, or I can put another thing. Let's see. I think I have to buy for a systematic review. It's not going to give me. So many of these are paid, right? So here it gives me an abstract of fertility, sterility, removal of endometriosis before IVF does not improve fertility outcome. Case control study. Then this is another that it's going to give me. So these are paid apps and these are the outcomes. Now here what they're telling me here is they're giving me the paper and they're giving me the abstract summary. Let's say I want to get more information. So here is the option what I can scroll through. So here it is methodology, intervention, outcome measure. So here is the outcome measured is if I go on this side, you will see I can also see the outcome measure. Here they're talking about fertilization rate, number of embryos obtained per cycle, number of embryos transferred, date of implantation. If I want the limitations of the study, okay, so limitations, I get one more column over here where they talk about the limitations of the study. So what were the limitations of the study? So here ongoing debate about this is this, the surgery may be a confounding factor. So like here you can get the here you have the so this study was a retrospective design, potential bias due to retrospective nature, limited generalizability to match case control design. So yes, you do get a limitation, but I just feel that as a clinician and as a researcher, we like to go in more in-depth analysis of this. So this is again giving you a broad base. I don't think we completely rely on this. We as clinicians, as researchers, would probably, when we read up the articles, we do a better job. But yes, you do get a rough idea of how to go about this. Right. So this is it. Then you have your another search, PubMed AI. This is again a very interesting, like, let me see. I talk about endometrial receptivity here. Endometrial receptivity in IVF site. Let's see how many. So here again, you have a lot of articles that are coming up. So I personally found this very interesting because here you have almost all the articles from PubMed. We get probably nice here or will be, put in this. And so how does so it has given me leads. So now it has given me leads that you can ask this question. How does hyaluron metabolism influence endometrial receptive? What role of seminal plasma modulating? So let's say I use this. I click on this and I get my eye. So it's also giving me leads on what to search for. And as I'm doing it, it's giving me key insights. It's giving me the whole summary. This is a list of literature of all the articles that it has used for me to cross-reference it. This is what I'm getting over here, right? And in the end, you have this. So this is it. So here you have, this was the result summary which we had in the top where it was giving us the result endometrial receptor. What is this? Here it talks about the AI research co-pilot, where it talks about the critical factors, on the basis of research. And here you are having the list of all the literature list that you have. This is how it is giving you the list and even prompting you to question. And you have the option of sharing this as a link or thing. You can share the content. That option is also. So I think you have to log in for that. And there is another one that is SciSpace. So all these are similar. You have this option. You can create your own library. Like, and I think in SciSpace, you can even create your own library. I think I did this. You can upload your own journals. See, I created a folder before I was trying. So this was like on the endometriosis. I have uploaded 3 articles, and I have uploaded these articles, and I fed this into the folder. So now it is giving me the summary of all these 3 articles. It has given me the summary. Okay, and there is also an option of presentation in SciPace where I can upload photographs, multimedia, and then you can also uh, share it to a PPT. You can also make a PPT out of there. That option is also there, which you can do in size. I have it. You can even upload photos, you can export it to PPT, you can use it. All these things are also there. Here again, yeah. So, coming back to my presentation. So basically, this is how AI works. One second. So, having summarized this, then there are tools that are available that can you see my screen? I hope it's visible now. So these are the tools that we as researchers can use to look for queries, to look for articles, and obviously this can be a guiding tool. I would not say we can 100 rely on that. We as humans probably do a better job of tackling these questions. But yes, if you have shortage of time or thinking, it can help you go through a lot of articles, take out the relevant ones, and then help you process. Now, coming on to patient-based apps, so I think we have discussed this. Again, the prompt that you give is important. Keyword searching concept should be connected by an open-ended phrase and a focus on appropriate subject matter. And these are the various apps. I think more will be developing, so that's okay. And this is a little controversial, but just I'm mentioning it here because it is available. That these are various apps that patients can use. Aadha Health basically gives, depending on your symptoms now, it can answer your health questions, probably give you suggestions, suggest treatment. Again, controversial, not get into that. Then you have apps like Microsoft Azure Health Bot, which you as a patient can ask a query, and there can be an AI assistant is there who can help you evaluate your diagnostics, tell you the how to go about the lab testing and all that. So these are all paid apps I did not have access to, but I just wanted to let you know that they are available now. Then August is there again, where you have an AI assistant. AI works as an assistant who analyzes lab reports, manages medication, and provides personalized health guidance. And to summarize, basically, they are should be used as a support system, not as replacement of clinical judgment, as we have all agreed on. The regulations, we are still not in the nascent phase, which will probably become more stringent, and as our AI apps improve. And some AI models are black boxes. The decision-making process is not transparent. So how reliable they are, which have already been pointed out previously, and choose tools that integrate seamlessly with the existing workflow so that you do not disrupt your practice. So, and you have those general boxes like ChatGPT, medical chat, which we all have been using. Thank you.
Thank you, Dr. Garima. It was actually quite an eye opener for me. But then there are certain questions also which are there in the chat box.
Yeah.
I just opened that, and Dr. Ruma has also asked, like, for like clinical key. She asked, how would you rate clinical key versus a PubMed research search? Sorry.
See, honestly speaking, I was as lost as you are before preparing for these slides. So I'm not a very AI person, and these apps are new. But I personally like PubMed AI. I like it because most of the articles were from PubMed, and the way they summarize, they liked it. But still, I'm too early. I probably did use it for 1 or 2 days, but maybe if you use it more, get to it. I think you can search same topics and see how the results come and you'll get to know. But I personally like the PubMed app.
So
Yeah.
clinical key, as per me, is limited in what it
Yeah,
has to offer. It
yeah,
is, first of all, it's a paid thing. It's a subscription. You can't
yeah,
access everything on it
yeah,
unless you pay for it. And there are some libraries, perhaps in institutions, that will offer that service.
yeah,
So Gangaram, for instance, offers that service. The other thing is, it is, of course, looking at books, journals, maybe internet articles, but largely books and journals from which it is giving you those answers. PubMed's base is much wider.
yeah,
And of course, there's a method to it. The how you look for your articles. There could be a, maybe we've done this before, Garima, but we can do this again on
yeah.
how to do a literature search on PubMed,
Absolutely,
which
absolutely.
is what we have grown up doing. First, you
Yeah,
learn that
yeah,
before we move on to consensus AI, which was, of course, an eye opener for all of us, that it is doing much more than just picking up articles. It's summarizing them for you. It is putting a
yeah.
summary together. But tell me, does it rate papers? Does it sort of assess biases in it? Is it able to do that? Because if
The
that
limitations, see, the limitations were mentioned. I
a
think it was
game changer.
consensus app, but I wasn't very happy with the limitations they gave. They were very general, broad based. I think we would be able to pick up much better these limitations. So
Because a
technically,
real game changer would
yeah,
be
yeah.
sort of for the AI to be able to critically analyze a
No,
paper,
no, no. Critical
where
analysts,
it is, yeah, coming from, whether to
yeah,
include it in your result summary at all or not. And that is still sort of, we rely on traditional methods, which is a process of learning
yeah,
research methods, which allows you to understand what paper to derive inferences from
right.
and what papers to completely reject. So would you say any of these, what the PubMed AI or your consensus or Google
Yeah.
Genesis, would any of these be able to do that?
They would see, basically I could use it as a guiding template, but I would not rely on it completely. In fact, I did not even like the plain language summary and the limitations and all that. I think we would do a much better job than doing that.
Right.
So it's
So
a very
what would
baby thing
your
for us.
message be to, let's say, some of the students who might have joined us? Would
Yeah,
you say it's okay to use it, or use it carefully and maybe
yeah,
check with your guide, check with someone on
yeah,
whether this is, and do maybe a
yeah.
not a hand search, but individually put those references
Yeah.
in PubMed to see whether these were generated or
For somebody who's completely new to research, probably they can use it as a guiding template under guidance and work upon this. This could be just like a basic skeleton, and if we need to work upon it further, that is what I would think. And take it with a pinch of salt. Do not take everything on the face value that's given there.
Yes. So, could you share any of your experiences with AI usage? What is it that you use the most? Do you use the generative AI models, the like ChatGPT or Claude for?
Yeah, I have been actually, whenever you put a Google search, now all our devices are automatically get that AI summary. This is something you cannot escape from. So yes, but again, I find it very broad based. Maybe I would probably use snippets of it, but they never suffice. You have to go for your own search in the traditional way that we used
Hmm.
to go and get the appropriate answer. Maybe introductory, maybe a little bit here and there, not
Yeah.
much.
Yeah, I think I was looking at this larger message when we conceived of this topic, that Google Baba has been this sort of all-knowing
Yeah,
entity which kind of answers most of our questions. The I think the message here was that we do that. We instantly, I mean, I still do that. Oh, what is it? And the first answer it throws up, and I say, okay, this is the
yeah,
answer. But the point is, especially when it's clinical research questions. So, for instance, we had kind of know this, and there's almost a consensus on this, that endometriotic cyst surgery for endometriosis pre-IVF is not needed unless you have these conditions, like a very large cyst, which is obstructing your way to the
yeah,
follicle, or there's severe
yeah,
pain. You're trying to rule out cancer, and there is enough suggestion that that could be the case,
right.
or perhaps. So, I mean, we more or less have a consensus on that. What about, let's say, something that we yet have to establish a consensus on? So, for instance, PRP usage for Asherman syndrome, or stem cell therapy for Asherman syndrome. Now, here you will have case reports, you will have maybe some case series. it'll be difficult for you to find largish kind of studies, and even more difficult to find randomized trials. Let's say this is what the AI has, and AI is going to derive whatever information it can from what's available and give you a summary that it helps, maybe use that it is, and maybe the first paper it finds, which is open access. Remember that it can't access papers behind a paywall, and some of the best ones are published in journals that are paid. So human reproduction, you don't have access to; fertile sterile, you don't have access to unless you have institutional access. So most of these so all the open, so the frontiers in endocrinology, these are like heavily funded people, authors kind of pay huge sums of money to get their papers published, 2 to 3 lakhs. These are papers that haven't found their ways into good journals. These are the ones that are openly available. And when AI is, of course, so there are some limitations and we can talk about it, but when some AI versions like ChatGPT 5, which has access to internet versions, it will use this information from frontiers and whatever to formulate its answer. It will not be able to pick up stuff from, the journals that are behind a paywall. And let's say there were exactly 3 articles on PRP usage, or let's say stem cell usage in Asherman syndrome. It will, and the 3 articles are the ones which have a lot of biases. They have been published in these open access places. It will give you a summary from those saying it helps, almost always having that bias. So it is important for you to kind of understand this, right? It is all right to search. Remember that all the papers that you get today are those open access frontiers. And I'm sure Dr. Divya and Dr. Garima would be able to tell us which are the ones that students most often come back to them with, that these are the articles I found on my literature search. These are ones from there. So remember, there is limitation to AI usage. Your Google Meta AI, or even we'll come to ChatGPT. I'm actually quite impressed with its function. We will probably talk about it another day and how to use it responsibly and ethically, actually sort of do a demonstration. But most of the answers that you get on Google are from a limited database, they may not be able to do a critical analysis of papers that have been published. And that is perhaps the biggest limitation of AI usage, that you still have to use your brains, which it hasn't been taught to do.
For this, I would like you to refer to the EPO guidelines that we were working upon together. So if you remember all the articles, how they were scrutinized by us with p-value, with graphs, with patient population, and look for bias. So you cannot expect AI at present day to do that in-depth analysis. And there is no point in summarizing something which is not there. But yes, maybe some general practitioner who wants to have a look at what to do in this scenario, a broad idea they can get, but obviously definitely not as good as the recommendation. Divya, you want to add something?
Ma'am, I just wanted to say, while formulating research question, whatever is the use of AI, we do brainstorming, we do massive literature search, but at the end of it, after formulating it, it has to be subjected to a peer and ethics review.
Absolutely.
To improve the quality. AI cannot do that. So that cannot be replaced.
No, there's one thing, there were apps, actually, it was available on my mobile. I could not get it on my phone, and it was not related to today's topic. There are apps that actually will give you whole thesis or research paper. There's specific areas where you can upload your references or your study, you can write the title and names, and they're going to actually come out with a whole thesis. But from whatever the paper section I got, obviously the quality will not be as good as you would write. It's a very broad-based.
And as Dr. Uma highlighted, even I have used it, most of the citations which they give references, they are fabricated. You have to counter check, and plagiarism is one thing. So we have to use it ethical and responsible use is the crux.
Absolutely. The bottom line is use it responsibly. Don't get swayed away by so many AI apps that have come up. Yeah.
So get on top of it. I mean, even to people
Yeah.
our generation, I wouldn't say negate it. No, it's useless. I know there will be a version which will be able to do all this. So, but
With
right
time.
now, I think our job as people who guide younger people who come into the profession, it helps to kind of know its limitations and its advantages. So some of us may use it for literature review, of course, knowing that it may have fabricated some, but still it's still giving you a large body or bulk that you can go through, the list you can go through. However, I think this was an absolutely sort of wonderful session. And would Dr. Siddharth want to say something, or any of our attendees want to say something?
Uh, Nothing, ma'am. It's a wonderful session, especially the second talk was really, Dr. Garima's talk was really, eye-opening talk. So I missed a little bit in the initial because I have to attend something, but really then I enjoyed it. I should say both the talks are actually good.
I
Really
enjoyed
good.
preparing it. It was an eye opener for me also. I was all muddled up 2 days ago, and now at least I
No, that's a
understand
great
something.
effort. We need to give a applause, good applause for that because it's a great. It's not easy to understand all those tools and
Absolutely.
she understood it. She didn't just present. She understood everything.
Yes. All right. With this, I think we shall close the webinar today. And I'd like to thank all our participants, Professor Pankaj Shah, Dr. Garima Kapoor, for their fabulous, fabulous talks and giving us an insight into a subject which is otherwise quite befuddling for all of us. Thank you, attendees, for staying on till the end. And thank you, Rahul, for the back-end support, and all the chairpersons for being here and conducting this session smoothly. Thank you.
Thank you. Thank you.